Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 1024th episode. Let's have the headlines of the day. Viral infections cause negative outcomes in pregnant women and their offsprings. Influenza A virus during pregnancy disrupts maternal intestinal immunity and fetal cortical development in a dose and time dependent manner. COVID in pregnancy can cause health issues in babies, studies suggest. Pune faces a rising Zika virus threat with several recent cases, including two pregnant women. Vaccine shows promise against CMV, a virus that causes birth defects. Let's go to the topic of the day. Today, we will be talking about viral infections during pregnancy. Dr. Sujit G, a distinguished obstetrician and gynecologist, boasts an extensive clinical experience of over 7 years, presently affiliated with PD Hinduja Hospital in Khar. He holds a notable DNB in obstetrics and gynecology from esteemed National Board of Examinations in New Delhi. As a passionate educator, Dr. Ash believes that awareness is the best approach towards prevention, thus molding his efforts towards effective patient education. With a resolute commitment to women's health and social issues, he encourages open dialogue, empowering women to address their concerns and take treatment. His renowned podcast, Guys from Gynec, reverberates across social media, captivating audiences with his focus on women-centric sensitive topics and health matters. So as we know, वायरल इन्फेक्शंस बहुत खतरनाक होती हैं. हर वायरस की ट्रीटमेंट भी नहीं होती. कुछ वायरसेस की वैक्सीन होती हैं, पर इनसे निपटना कैसे है, आज हमें बताएंगे डॉक्टर सुजीत. So shall we start, Doctor?
Sure. Good evening and thank you, Dr. Anita, for the warm welcome.
Thank you. So, what are the specific viral infections that pose the highest risk during pregnancy?
See, as we live in a country like India, where we have to worry about the population and the viruses that are majorly transmitted by the aerosol or the air media. So we have to worry about influenza or the COVID virus that we are already aware of. Apart that, we have certain viruses which are very threatening for the baby and even for the mother, which includes rubella, varicella, and cytomegalovirus. And with the recent travel history, Zika virus is something which we are all coming across. That's also one of the threatening issues, which is majorly affecting South America and Africa. But yes, we are seeing cases in India. So majorly, these are the ones which I would suggest that we worry about and take necessary precautions or try to manage them.
बिल्कुल सही कहा आपने. So how do these viral infections like Zika virus or cytomegalovirus affect the pregnancy outcome?
So every virus can affect a pregnancy differently. It can either affect the mother or the baby. So whenever you have a viral infection, the body tries to kill it off. And that is what we always know that yes, the immunity will be fighting for it and we have fever. And there is rise of the inflammatory responses which happen. And this can affect the mother. The mother can have certain issues like pneumonia. If it's something like a HSV virus, which I guess, we'll be talking about later on also, the herpes simplex, you might show some blisters here and there. The rubella, rubeola, all these things, the measles, that is the rubeola, rubella, you might have some spots around the face that is very significant, which tells us about the virus. Zika virus and everything, we have a lot of pneumonia and then respiratory involvement which happens. This is specifically for the mother. As the fever profile rises, as the fever is uncontrolled and the inflammatory response is more, this can lead to miscarriages. That is what we as gynacs are worried about. Whatever happens whenever we have a viral infection, it depends when it has happened, whether it's the first trimester, second trimester, or third trimester. So, depending upon when the woman presents with these viral infections, we know that these are the risks which are involved for the fetus inside in utero. And that is how we prepare ourselves as doctors to manage it.
Right. So there are certain other viruses like herpes simplex virus. How does it cause complications during pregnancy?
So herpes is something which we have two variants. I'll just give a brief outline. We have the HSV1 and HSV2. HSV1 is which is basically the oral, and otherwise in the body. HSV2 is the genital herpes. That is something which we are worried about as gynacs because genital herpes, an active lesion, if present during the time of delivery, a vaginal delivery, the baby might come in contact with the virus itself, and that is how it transmits. And the baby can have congenital conjunctivitis, or can have blisters over the body, or can have congenital pneumonia because of the HSP. How do you manage it? This is the only condition, I guess, in the viral infection where you're allowed to do a cesarean section so as to avoid the chance of contamination with the virus. Apart from that, the routine treatment for the mother is something which is essential, and that is how you basically manage HSP. Regarding the few things that we were discussing that you asked me regarding the CMV and the Zika, I just missed out on that part. Cytomegalovirus is one of the deadliest viruses. That is what we call which has to be infecting a mother because it's a part of the torch infection also, which I guess everyone hears about it or knows about it as you read in MBBS also. So yes, chances of miscarriages are very high, but it can affect the brain, the neuronal development. There is a microcephaly, the head is smaller. It can affect other areas of the body. Majorly the psycho neurological development thing, the delayed milestone thing that happened with cytomegalovirus is something which is very dreadful. With Zika virus, it's majorly something which affects the mother, and that is how it affects the baby. So if the mother is compromised, her immunity is compromised, and her health is at risk, then we are worried about that part. And otherwise, the course of action is something which affects the neurological development. Most of the viruses, what we talk about, affect the neurological development of the baby in the later term, leading to delayed milestones or some brain injury.
Right. So besides increasing the risk of miscarriage, does the chance of stillbirth, or dead baby being born also increase due to these viral infections?
Rarely, not much. Stillborns and everything. See, stillborns happen when there's a placental insufficiency. There is not majorly placental insufficiency that happens, and the outcome, wherever it affects the respiratory system, is not that developed in a fetus. So yes, you don't see any respiratory infection at the time. These develop once the baby is delivered. The neurological impact also happens later on over the time. So stillbirths are less. You get IUGR, which is very common, and you might get a preterm delivery because of fever and inflammatory response. Stillbirth, overall, the deaths which are there, which are seen, are neonatal deaths, which is slightly on the higher side because when you have an infection like CMV or congenital varicella syndrome, these things can have neonatal deaths more compared to having a stillborn.
And how does this virus from the mother goes to the baby during pregnancy?
So depends which virus we are talking about. The most dangerous one, like you were discussing, is the cytomegalovirus. This is something which can transmit across the placenta. It can go via the body fluids. It can go via the genital secretions. It can go via the breast milk everywhere. So this is one of the most dangerous ones. Apart from these, most of them can cross the placenta, and that is why in future, if we had to test or if we do any testing, it's always based on the IgM testing that we do. Maybe just Zika virus, which requires a cell-free cell media to cultivate. Apart from that, most of these things we have IgM sensitivity that we can do, and that can help us, whether a positive or negative value can help us predict the infection. So yes, these viruses are transmitted via the placenta, via the uteroplacental loop. But the good thing is, as we are talking, the immunity is also transferred. So the IgM, IgG bodies develop. IgM is difficult to transmit across the placenta. That is why we just come to know that this is the virus which is infected. But if it's a chronic thing, that maybe like a varicella or a rubella, where the infections are already there in the mother beforehand, not during the pregnancy, takes over, and that can transmit across the placenta. And therefore, the chances of baby having any viral infection regarding rubella and varicella are significantly less.
So, how early in pregnancy can these viral infections affect the developing fetus?
As early. So that we spoke about, the most viral dangerous infection which happen are in the first trimester because that is when the developing organs are affected. So again, basic examples, if you have a varicella infection, which is a chicken pox, that might affect the limb development if it happened in the first trimester. If you have anything like a cytomegalovirus or a rubella virus, that might lead to brain defects, microcephaly, cataract, hearing deafness, sensory hearing loss, which is very common in rubella. So that affects very early in the trimesters. Towards the later half, so varicella is one of the most deadly things to have around the third trimester. So it is said that if you have a varicella infection for a mother, 5 days before and 2 days after delivery, if you see that part where she's infected, then the babies have very high chances of mortality, where the neonatal mortality increases as more as around 30-40%, which is quite significant. That's the only virus which has a very deadly outcome around the third trimester. But most of them affecting the first trimester is dangerous, except one significant. I always remember. I tell my students that parvovirus. If we talk about that, that usually affects around the second trimester, and that is where you get anemia and you can get hydrops. So a reason of non-immune hydrops fetalis seen in the second trimester with anemia, with a sonography showing MCA changes, there's only one thing that you'll think about, that's the parvovirus. Apart from that,
Excuse me.
depending upon the thing that we discussed about, that is how you reach out to the diagnosis.
So, like the heart develops during the second trimester. So, if there is a viral infection during those second 3 months of pregnancy, can it affect the heart? And which particular viruses can do that?
It can affect the heart. It usually the cytomegalovirus is again one of the major culprits that can affect the heart. Zika is also thought to be a little cardiotoxic. But second trimesters, the infections are slightly maybe because of the immunity part, or maybe because the woman is visiting the gynec more frequently. So we pick it up early. But then these are the two major things if we have to worry about the cardiac events which are required and because of the virus things. Otherwise, major things if you read about or if you come across your patients, we are worried about the neurological aspect and the respiratory aspect after the delivery. And for the mother, similar things.
So, like uh, viral infections like influenza, they are managed differently in pregnant women compared to others.
Uh, any viral infection, if you come across, I'll just give a brief statement for everyone that any viral infection during pregnancy, you just have to do symptomatic management. Viral is managed like that. We don't give any antivirals. So there's no change in the management, but you try to reduce the fever. That's a major thing. What I do separately, I don't know if everyone does it, but around the third month or the end of the first trimester, I usually administer a influenza vaccine. So that is how you can make it better for the woman over the entire pregnancy that she is not affected during the second and the third trimester and during the breastfeeding phase also. She's protected from the influenza infection. So if this is followed as a routine, I guess at least our patients are safe from the seasonal flu infection.
Yes, you're right. Actually, till the baby goes for the flu vaccine, baby will also be protected for some time. That's a very good suggestion you've given. So, what preventive measures do you recommend to reduce the risk of viral infections during pregnancy?
Uh, First thing is maintain proper hygiene, washing your hands. It's very easy. Like what we followed in COVID, I think everyone has
COVID,
become
yes.
more careful after the COVID that wearing, washing of hands, covering your mouth if you have sneezing, or if you feel that there's some cough, cold, you wear a mask. All these things are important. If you have a fever, avoid contact with the participants or the people who are around who have fever, who have some rashes. So this reduces the contact of the pregnant mother with those carriers, and this is how you can do a safety approach. If anything, tell the patient that if any fever, anything which happens, you are easily approachable. Try to manage your fever depending upon which situation. Like right now, it's a monsoon. We know that fever is very common. Try to identify whether it's something which is related to a parasite like a malaria or a dengue, or it's something which is related to viral, depending upon a proper history taking. And once you've reached the diagnosis, then just provide symptomatic management. hydration becomes very important. That is what you do. Control your fever with paracetamol. Give maybe boost up with the vitamins that you can do. Give some steam inhalation. Give some anti-cough things which you can do, which is on the basic level rather than giving a higher dose. And have a proper balanced diet. And I think these are the basic things which will help for any infection.
That's really nice. And any specific dietary recommendations to strengthen the immune system of these pregnant women?
So more than the pregnant woman, I usually stress on one point, which is the preconception counseling. So once the patient comes to you to plan a baby, there are certain infected markers that you can do. So you can do a torch infection in case if you require. So toxoplasma and cytomegalo are covered there. But what we specifically stress on is the rubella IgG IgM in India. And overall, I even ask for the varicella IgG IgM. So if you find that the IgG is positive, then it means that the patient has immunity. So we don't have to do anything. And those viruses are definitely eliminated from our thought process even later on. But if you find that the IgM and IgG are not positive, at that point, you can always advise for a vaccination before the patient plans for a pregnancy. So you can ask for a rubella vaccination and a varicella vaccination. These things are sorted out. So then tell the patient that yes, now go ahead and plan for a pregnancy so that I am ruling out these few things which are under my control, which can be helpful for the patient during pregnancy.
Right. So, any role of prenatal vitamins and supplements to prevent viral infections during pregnancy?
Uh, Vitamin D is supposed to increase the immunity. That is what we've all consumed throughout the COVID time. And I guess people still consume it because now they've got a hang of it. It's a good thing. Vitamin C also helps with your immunity. So, yes, that is important. Proper diet, because if your mucosal levels are damaged, if your mucosa is damaged, then the virus has a very high chance of contracting and staying there. So it can be because of vitamin D, vitamin A deficiency, yes, where your mucosa can be damaged. But otherwise, if you're having a proper antioxidants in your diet, eating well, and managing with your vitamin C higher doses and vitamin D, these are the major things that you control on, and your B12 because that also will be improving your gut movement and with everything. Apart from that, again, just basic things, anyone can get a viral. We all get viral infections every time. But then pregnancy becomes a challenging situation because you have to manage the mother and the baby. So when you follow these things in your routine thing, I think everyone will be fine around the pregnant mother and everyone is happy and then the doctor is more
Yes, I agree with you. Like we were talking about Zika virus, there are certain areas where it is more common. So, can pregnant women travel to areas with such higher risk of viral outbreaks? And what precautions should they take if they go there?
usually advised not to travel in those areas. See, as an understanding patient, if you explain that patient that if you're planning for a baby, avoid travel to those areas, African continents, South American continents. These have a very high risk of Zika virus thing. And once the patient comes back, and if the patient gives any symptoms, to check for the Zika thing. Initial days, we used to do a lot of photosynthesis and check for any viral infection, but Zika can be cultivated in a cell media. So yes, these viruses can be found out. And again, a proper history taking where you find out the travel history, probe for it, because we are not that prone to asking a travel history. Rather than we'll be asking whether you've had outside food or anyone around your neighborhood has had some viral infection. But include that extra point when you're managing the patient with these things that have you traveled abroad to these places which can have a Zika virus outbreak. 2015, 2016 is when we labeled Zika virus as a dangerous thing by WHO. So yes, since then, this is something which we are considering to be very important and has to be managed well because the maternal mortality is something which is affecting. And once that is affecting, obviously the fetus outcome is not very good. So that is why it becomes more dangerous for us.
Right. There's another question, like HIV is also a viral infection. Infections which predominantly cause jaundice, like hepatitis E virus, hepatitis B virus, C virus. For these certain medications, antivirals are given to the patients. So these and other antiviral medications for treating viral infections during pregnancy, are they safe for the baby?
The major thing is you have to consider the viral load. and that is when we start the treatment. So that is how one has to proceed whenever you come across a hepatitis B or HIV. Hepatitis E and A are fecal, so that's not something which is inbuilt or in the system. If you get from eating outside, that is something which can complicate an E and E. E is something which is very dangerous during pregnancy with a mortality of around more than 50%. We recently had a patient who died because of hepatitis E, and that is something dangerous because the patient can just have cascading effects with the liver parameters going deranged, and the patient can die, and obviously the baby won't survive also. But B and hepatitis B, having a hepatitis B known patient, hepatitis C patient, and HIV patient, the treatment is very good. We have to just inform the treating doctor. So ideal thing would be refer to the infection disease doctor who manages the drugs or the physician, and that doctor will understand that the patient is pregnant and change the medication over. It is completely safe for the baby, and we continue with the management. Breastfeeding also is advised because that's a routine question that we get, that should the mother be breastfeeding in such scenarios? Yes, that's definitely safe. That also we continue, and the outcomes are comparatively much better. Just that you have to reduce the spillage of blood during the delivery, and the cord control, the cord clamping has to happen a little faster. So these are basic things which we all know about. But overall, in general, we don't include these things in the viral infection studies because these are something which we have very standard protocols and it's very easy to maintain compared to the outbreaks which can happen regarding the seasonal viruses.
Right. So, besides abortions and stillbirths and all those things, can these infections affect the baby's growth and development also in the uterus?
Yes, so in the uterus, yes, they lead to IUGR because of uteroplacental insufficiency. It can happen. Congenital limb deformities, which are very common with certain viruses, like we discussed, like varicella, that will affect, which may lead to shortening of limbs. More importantly, is after the delivery, where you have neurological side effects, or the baby can have ADHD, or baby can have attention deficit disorder. That is what we call as ADHD, or the milestones will get late, the milestones won't be there. The baby might be not very responsive. So all these things are the major worries that we worry about whenever we have any viral infections, the known viral infection during pregnancy. This is what we are currently also researching for COVID virus. So we still don't have enough data regarding COVID and what the sequelae can be. So these are also the aspects that we're testing for COVID virus. So neurological, what impact happens is very difficult to assess immediately after delivery. It has to be given a time period and the milestones have to be monitored. Maybe after 5 years or 10 years, only then can we understand what the virus or how much the
Yes.
virus has done the damage to the brain. So we have to do it over a long term monitoring.
Right. So, like we gave COVID vaccines to pregnant women, there are other vaccines which provide immunity against so many viruses. Can they be given safely during pregnancy?
During pregnancy, we don't allow any virus vaccine except the tetanus. And I usually do a Tdap dose, the tetanus, diphtheria, and whooping cough dose, as a routine for all my patients, just around the tetanus doses that we mix up. Those are the only vaccines which are considered to be safe in pregnancy. So your influenza vaccine, which I give it at 12 weeks, the tetanus, I give 2 doses along with the Tdap. That can be done around 26 to 32 weeks, that you finish it on 30 to 26. Those are the only vaccines which are currently said to be safe during pregnancy. Apart from that, the ones like mentioned, the rubella and the varicella, or even the HPV vaccine, that is something which I commonly advise to anyone who comes to me for preconception. Everything is before the pregnancy or at least 6 months after the delivery is done.
So many a times a pregnant woman would be exposed to somebody with chicken pox or measles. So what do we advise to them?
Keep a check on the fever pattern. Chickenpox is very dangerous for adults, but then if you are infected in the childhood or over the lifetime, you definitely tend to have an immunity to chickenpox, and therefore it's not something that one would be worried about, and the immunity is always there. Same for measles, but if the vaccination is not done, then they might be at a higher risk. Usually, it's very classical of chickenpox and measles to show rashes. You might have rashes with measles. I forgot the name. There's a specific name for a measles rash which is there, but chickenpox you can definitely see the blisters which are there. So that is how you come to know. And the infective stages, once the rashes start happening, that is when the infection happens. There's an incubation period of at least a week when things start happening, and that is where people transmit a lot because they are not aware about the infection. For the baby, like we discussed, chickenpox, it can lead to, for the baby, limb deformity and everything. For the rubella thing, yes, it can lead to cataracts, it can lead to sensory neural hearing loss. That's the more dangerous part with the rubella. And these can lead to microcalcification in the brain, it can lead to microcephalus. So all these things are part and parcel. The good thing would be once you know about these things, get a proper ultrasound every time when the patient comes to visit you with a proper anomaly thing ruling out. But at least you can predict the brain deformity if it's happening. But again, overall, the deafness and the cataracts and everything can be understood only when the delivery happens. So the patient has to be explained in detail regarding these complications throughout the pregnancy.
Right. So, how can the partner or other family members support a pregnant woman in reducing their risk for viral infections?
Support the woman always. There's not just
Mhm.
during viral infections, but yes, that's something which is important that they have to understand that a woman in pregnancy is more vulnerable for any infection, not just viral, but even bacterial. So it starts right from the time of conception that she has to be reminded regarding hydration, regarding proper food, regarding her supplements. Apart from that, if anyone is known to be a carrier of certain diseases or if is traveling abroad, so at least try to maintain the gap of meeting the patient at least during the incubation period where you're symptomatic. Avoid reducing that time period, avoid the time period of exchange so that you can make sure things are better. If any complaints, it has to be always brought to the notice of the gynec because everyone thinks they are a doctor at home. So that is something which is not supposed to be taken for granted. In pregnancy, even a minor UTI is supposed to be reported because that also can lead to miscarriages or preterm delivery. So any fever, any respiratory changes, any other rashes, everything has to be reported. And depending upon what we find out, that has to be carried on and understood by the entire family member, specifically by the partner, where he is also made to understand that these are the things that are there. Treatment has to be followed properly, and throughout the treatment, the charting and everything. If admission required, admission. If not, at home, the charting has to be done where the family is there around motivating the patient and also being there as a strength. And if there are any complications that are to be occurring, the entire family is explained regarding the prognosis of such situations.
Right. So, since you deal with so many patients of this kind, are there any psychological or emotional impacts of dealing with a viral infection diagnosed during pregnancy?
So we all have experienced COVID and the psychological impact that happens to a mother because yet we don't know what can happen during COVID and pregnancy majorly. But then it's a challenging thing for a mother to go through any viral infection or just for the matter, even fever, because the first thought is my baby safe? So what you do is the best thing what you can do for the patient is either make the patient listen to the heartbeat or get an ultrasound done. Once she sees the baby moving around or she hears to the heartbeat, she herself is content that yes, things are moving fine because that is what they are majorly worried about. Once you reach to a diagnosis, maybe you can't like if it's something like just an influenza thing which is there, then just manage by basic things and tell the patient that this is something which is very common. And if something which is dangerous, try to calm the patient down, get a family involvement, and then talk about different things with whatever monitoring that is required during that time period. And then after delivery, that is where the major role comes in. That those are the challenges that we have to face after delivery. So get a proper pediatrician or a neonatologist along with a better team so that everyone is there around post the delivery.
So, any take home message for our listeners and viewers?
Take home messages for viral infection. It's one of the commonest infection that we can come across during pregnancy, and not everything is dangerous. But then you have to understand that if it is something which is difficult to control, always have a infection control doctor, infection specialist, or a physician in your team who understand these things more. Because honestly, even I don't understand a lot of things. So even I might be speaking in front of you saying that I know everything, but you can't pick up everything. So have a doctor. If there's a case of fever, and if you find that there are certain other symptoms that patient complains, involve a physician, ask the physician to have a look, and get a proper blood investigation if required, get sonography, and always involve the family. That is one of the most important things which is required during any viral infections, because you might never know who the source is. So it's always wiser to tell them that these are the things that are happening. And once things are fine, symptomatic treatment most of the times, just guide the patient to a better outcome for the mother and the baby. That's it. The rest, we
Thank
are all wise enough. Viral,
yes,
everyone can manage.
yes. Thank you, Dr. Sujit, for joining us today. Could you show us the certificate, please? This is a
Thank you so
small
much.
token of thanks from our side, though you've been
Thank
really
you.
good about telling so many minor details also. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you.